we are going to talk about different cases, 5 different cases. I'm going to walk through a consult, and I know not everybody's in the same place. So we have a lot of people that own their own businesses, but some of you work in a clinical setting. I will argue that, we can provide sales in whether we own a business or not. Like, we're still selling ourselves. We want our patients to connect and trust us. So a lot of what I talk about is going to be consult related, but you can just utilize the content and the ideas in even like a session with a patient. So I am going to move forward here. I'm going to go through 5 different patients. What I really want to do is solidify the learning we've had and point out maybe a focus area. But also, like I just mentioned, I think it's important, is this typical? Is this what you're seeing? So we're going to talk about muscle mass. We're going to talk about a holistic approach. We are going to talk about focusing on gut health, some metabolic markers that I think are important, and then small sustainable changes and how impactful that can be. We're going to talk about mastering the consult. So this would be evaluating your approach to a consult. Go in prepared. Create a solution that provides value to the patient. I can't tell you often, we see things as value, but the patient sees it completely differently. So making sure you're coming at it from a patient perspective. And then if we have time, I'll have some questions in here to test your knowledge over these past 5 weeks, just to see, and if we don't get to them, it'll be nice for you as a reflection point afterwards of, do I have this? How would I answer these questions? I think when we can reflect, that's how we know the information is truly solidified. So, okay. So let's jump in with our first patient here. This would be a pretty typical person on semaglutide, 40-year-old female, pre-diabetic, diagnosed with PCOS on a low dose statin. So she came to us in our initial intake form. We ask what they currently are eating. And this is what she reported: frosted mini wheats with milk, coleslaw, an Italian sausage with a bun and onions and peppers and marinara sauce, and then Dr. Pepper, regular Dr. Pepper, water, grapes, watermelon. So as you can see, pretty high in carbohydrates here. A lot of room for improvement, I guess I would say. She was, though, before coming to us, on some different supplements, things that I would have actually recommend for someone with PCOS. She was on inositol, she was on berberine, NAC, and magnesium. I would definitely want to get her on CoQ10 right away with her being on that statin, and check her B vitamins. So what we noticed here, and if you are unfamiliar with InBody, hopefully I can get you comfortable with it. I know Sherry showed you some of this last week, but I pulled out the section here. This was her initial, and this was after 6 months, so that you can see this. But what I want to start off with was, she came to us just hungry all the time, not able to lose weight no matter what she was doing. And after that first 2 weeks, so we start them out on a very low dose, the 0.25 milligrams. After the very first 2 weeks, she came back and was like, what did you put me on? What is going on? Because she was only hungry at meals, which is exactly what we would want, right? It's interesting. So if you remember back to what we suggest for diet, so you might want to go back to week 2 to refer. We track and ask our patients each 2 weeks or every month, whenever they're coming in, what percent they were following the diet. And this is subjective, but she put 50%, and she followed 50% in general. And if you remember what we said, we see best results when patients follow 80% of the time. So she was only following 50. And we got her up to a max dose of 0.75 milligrams, which is still way below half, if not about a third of what that top dose is, the suggested dose. So she was able to stay nice and low. The other really cool thing about this situation is you can see her initial GI issues. And I know this is also small, but if you, our symptom surveys go up to a 4, and 0 is the least, 4 is the most frequent and the most significant. So you can see she had some constipation and belching, but that nausea, diarrhea, bloating, gas, lower abdominal pain were horrible for her. So we did suggest stool testing prior, but she's one that was like, no, I want to try this first. And we always have in mind, okay, we can keep her at a nice low dose if it is helping with that food noise and hunger. What we noticed just after the 2 weeks, her symptoms were significantly reduced from the GI standpoint. And then even at her highest dose at the 0.75, you can see she still was dealing with some constipation, but pretty much everything else went away. Just a little bit of nausea, usually around the injection day, a little bit of bloating, a little bit of gas. So she probably still should address the gut a little bit more, but I think part of it too is probably she's only following the diet 50%. So how much fiber is she actually getting in? There's probably other ways that she could improve to help reduce the constipation. So I went down a rabbit hole with the whole muscle mass thing again, because, I really was trying to compare typical weight loss on any non-GLP and what muscle mass looks like versus on the GLPs. So you've probably heard of the step 1 trial. This is where we got all of that data about weight loss being muscle mass. Well, when you look at other forms of weight loss outside of the GLPs, it's actually really similar muscle loss, which is really unfortunate. And I would really argue it has a lot to do with not being properly taken care of from a nutrition standpoint, from a dietitian, not stressing the importance of physical activity. And what I found interesting too is you can see 10 to 15% loss in females and higher in males. And what one study suggested, it's likely due to the fact that men just have more muscle mass. So there are a couple other things that I just want you to consider when we think about muscle mass, especially for obese patients, because they much more likely have that fat infiltration. The why can I not say this? Myosteatosis. There we go. So that fat infiltration. So what you can see here is some influential triggers. So metabolic disease being one of them. Aging, it's much more common. Muscle injury is a really common one as well. Disuse or inactivity. You can also see some of the interventions that were really helpful. And the link to that study was up here. This one down here, this graphic, I also really liked. And this was from a renal disease study, actually. But I liked how it showed the different components that can cause some of that fat infiltration. The other thing I want to talk about is muscle quality. So the study down here is really showing metabolically healthy versus unhealthy phenotypes and the quality of those muscle cells. So being able to have strength, but also being a healthy cell. And that's actually a really big piece. And it made me think even further into the days when I really dug deep into fasting. So when we fast, we see muscle loss to begin with, but what's happening on a cellular level is the body's smart and it's breaking down the more unhealthy muscle cells and using those amino acids to rebuild the muscle. So we've done this where, like with the Prolon fasting mimicking, where we would watch their in-body all throughout. And what we would see is, yes, the muscle would go down by that day 5 of that protocol. But when we reintroduced a really healthy diet afterwards with good protein in it, that jumped right back up, so it's breaking it down and then it's rebuilding right afterwards. So I can't help but think, as these obese patients are losing weight, some of what's happening is this breakdown of the more unhealthy muscle. And, after they get to a healthy weight, that would be a really important time to help increase that, the muscle quality. So, and back to, yes, we see on average here the 10 to 15% loss in females, 20 to 25 in males, but we don't have to accept that. That doesn't have to be the case. What has also been shown and what we see with our patients is that if they have adequate protein, that's really important. They're able to break it down and they do the resistance training, they are going to see results. They're not going to lose that muscle mass. Okay, so this is a 24-year-old vegetarian that came to us eating an all processed diet. I'm sure you see this. People will lie a little bit about what they have. This patient did not. She was straightforward and was drinking Coke every day, eating candy, and having ice cream. Her goal was to lose 40 pounds. She was on 7 months of semaglutide and went all the way up to the 1 milligram dose. Obviously right off the bat, we caution and we have her adjust her diet. We spent probably more time just focused on that diet with her at that initial session to make sure she wasn't going to have all of the symptoms with the injection. What I want to point out here is that week 2, again, just at that low dose, this is what our provider documented. She feels less bloated and has more energy just after that. She started to eat chicken. So, we're not going to force somebody to start eating animal protein, but we really did talk about the importance of muscle mass and protein. So she was eating just small amounts of it. She started out working on her breakfast and lunch. So making those small changes. Her cravings and food noise were completely gone. Again, I can't tell you how often we see that. And we talked about getting the exercise in. So she started swimming. And then after those 2 weeks, things were going so well, we kept her at that same low dose. We're not always titrating up. So this was fun, her disconnect here. So yes, she was 50% compliant. She shared that all the way along. She wasn't getting, enough protein and still having some processed foods. But what I want to talk about is on our biweekly symptom assessment, we put, constipation, diarrhea, some other different things. But then we also ask, how many bowel movements are you having in a week? And she put 2 to 3 per week. So obviously we know that is considered constipation, but the patient never really recognizes it as that because she was constipated to begin with. Now what she's going more often than what she was. So this seems like normal to her. So I always asking questions in a different way to make sure you're getting accurate information, I think is really important. So then you can see this is the changes in skeletal muscle mass over the weeks. So you can see after the first 2 weeks, it definitely dropped, but then we got her, because we're doing these in bodies, we can quickly say, look, we're seeing this change. We don't want this to happen. So then you can see she made some good changes, maintained it. She probably fell off a little bit here, and then maintained afterwards. So when you look at these in bodies, you can see even with just 50% compliance on here, we want to look at that visceral fat that has a lot to do with metabolic health. And you can see it was at 18, it went all the way down to 13. We want it at 10 or less ideally, but this is definitely really good progress. When we're looking at this sweet spot right in here, this darker area, when we look at skeletal muscle mass. So she's someone that came in on the lower end of the optimal range. So that's why, we had talked about adding the chicken in just as an option. You can see she did come down. So not following, she still had some muscle loss here. But that's why, every time we're talking about it, that's why we got her to maintain throughout here. But again, not perfect. So I'm not sure if you've seen this. If you are big into the GLPs, I'm sure you've seen this blasted all over the place. These are the updated nutritional priorities you can see it was a joint collaboration between these 4 different companies. And you can see all of these different components that are really important when you look at nutrition supporting this. So when I look at this patient we just talked about, where we really focused was on that preservation of muscle, that nutrition assessment, navigating her preferences, her want to be more vegetarian. We, talked about those nutrient deficiencies potentially related and not eating enough, and then promoting those lifestyle measures. So the fact that she started swimming, the fact that she was prepping her meals ahead of time and had breakfast and lunch figured out, really big wins, because long term, even after the GLPs, it'll be a big help. So this was one of my patients, really wonderful 75-year-old woman. It's never too late to get started with your health stuff. So she came to us previously having been on a GLP. She was on semaglutide and lost no weight being on it. She had just way too many symptoms as well. Her gut symptoms got way worse, so she stopped. And what I will say, so some of her symptoms were diarrhea, heartburn, bloating, gas. She had a lot of histamine responses. She was dealing with significant joint pain, headaches very frequently, got sick regularly, and had ringing in her ears. So she was definitely on board, as she had seen the GLPs did not work for her. She was on board with doing the GI map, the stool test. And when we did the test, she ended up having very low commensal, low good bacteria. We found a parasite. She, on her intake form, also said she had her gallbladder removed years ago. So that's definitely significant. And then we saw some overgrowth. So what we did with her, if you can see this down here, we use Practice Better. So this is how the protocols look. We did GI Revive. This is a supplement that's really supportive of the gut lining. We did 2 different probiotics. We did Restore Flora and Orthobiotic. Restore Flora I picked because of the Saccharomyces boulardii in there, which is really good with reducing the diarrhea. She just needed overall commensal growth as well. So that's why I did the orthobiotic. We did, because of the overgrowth and the parasite, we did use biocidin and antimicrobial to help reduce and rebalance. As I mentioned, she was dealing with a lot of histamine issues. So HistaAid is one. There's a lot of good supplements out there that are supportive at reducing the total histamine load, helping detoxify it out of the body. And then we did the liver gallbladder complex to help compensate for her not having a gallbladder. So you will see here, and she was one of my very compliant patients. So after we worked together for 4 months, she was feeling really good. And we moved over and we started with tirzepatide. Since she had the past experience with semaglutide, we just went right to tirzepatide. And you can see she went from 189 pounds down to 166. What I think is really significant and exciting is 75-year-old woman, she was at 52.5 here with skeletal muscle mass, and she ended at 52. So all of that weight loss still maintained muscle, but she was doing her regular exercise. I think it was 3 times a week with a group of ladies, kind of like a jazzercise sort of a class, and then did some strength training in her own home. So very cool to see. She went from 19 for visceral fat down to 15. And then for long-term supplements, we kept her on Megaspore. She did use the HistaAid product. We did also work on a lower histamine diet, and I just identified for her potential foods that can cause high histamine. We kept her on the liver gallbladder for supporting that digestive breakdown. And then we did put her on a multivitamin. So I know not everybody has access or even feels really comfortable with the stool testing. So I wanted to list out some different things that you can do and look at if you see that your patients are having some digestive issues. So I put it into 4 different categories. We can optimize digestion, we can balance the gut bacteria, we can reduce inflammation, and then we can look at meal type and spacing. So when we look at optimizing digestion, the easiest, like the simplest, but hardest thing to do is chewing thoroughly. And I will remind patients of this very frequently because it's something that they're like, oh, yeah, I totally can do that. And then they forget about it. So it's a good thing to remind them. Eating in a relaxed setting, we will not digest our food if we're not in a relaxed state. Saliva production is really important. There are certain patients that are on medications that it affects saliva production. Saliva is really important for the enzymes, and it is antibacterial as well. So it helps with making sure things are not getting through into the intestines that shouldn't. And then enough stomach acid. So for people that are really sensitive to protein, they say, I can't tolerate large amounts of protein or avoid protein. Look to the stomach acid and that being a potential issue. It could be as simple as having a teaspoon to a tablespoon of apple cider vinegar 10 minutes before a meal. I will say if you have people try that, if they end up having burning in their stomach after they eat for 20 to 30 minutes after they eat, they do not need the apple cider vinegar. We don't want to cause an issue. So definitely making sure they're educated on that piece. So balancing the gut bacteria, it's not super easy to tell what's going on if you don't have a stool test, but if you work slowly and build up and see what your patient's symptoms are, having prebiotics, having probiotics. I mentioned Saccharomyces boulardii is just excellent for patients that have chronic diarrhea. And then switching more plant-based because of all those additional fibers. So as we feed the good bacteria, we're going to have more diverse bacteria. Now, if you start upping the fiber and those plant-based foods and they start to get really bloated, that's definitely a sign of overgrowth, and they would definitely benefit from some testing. Some people really present with just inflammation. So you see those patients that have just like the inflamed, puffy face. They tend to have typical food sensitivity sort of symptoms, and you can assess that from the symptom assessment. It's easy to try, just gluten and dairy, remove it, and you get some, kickback on this. But I even say just try it for a week or just try it until we meet next time. Do you want optimal results? Well, this is worth a try if you've never tried it before. And a lot of people will benefit from that. I'm not one that I try to restrict or eliminate things, but sometimes when we are trying to get the body into a healthier state, we do need to cut back and you get a lot faster results. Supporting detoxification, so looking at their liver labs just to see, or just how, the symptoms that they present as well. Do they need extra support with detoxification? And it could be the body brushing or the sauna, could be getting more movement, but it could also be supporting the liver a little bit more with something like milk thistle. Supplements that help reduce inflammation. I've had great results with omega-3s and colostrum. So those could be an option for a patient to try. Meal type and spacing, when's the biggest meal? Sometimes they're eating really late at night, or their biggest meal is dinner, and just switching and having lunch be their biggest meal could be helpful. When certain macros are causing the issue, that can give you signs. If it's fats, liver, gallbladder. If it's the protein, it could be that stomach acid. If it's more of those fibers or carbs, then it could also be the enzymes or, pancreatic elastase number, but it could also be like that overgrowth. Spacing meals out, space 3 to 4 hours between meals. That's really helpful for that migrating motor complex to come through and clean up in between. And then a really big one, I know this is a hard one to convince patients too, but that coffee first thing in the morning can be such an issue. So getting them to either add something to their coffee or ideally starting with some food prior to their coffee, that can make a huge difference in digestive function as well. This is just a summary page of some of the supplements that we will recommend when people are on GLP-1s or after, like the GLP-1 boosters here, but like the pro and the prebiotics, a prokinetic to help with that motility, either too fast or too slow, digestive enzymes, potentially HCl if we've tested that out. Fiber supplements can be really helpful, especially for somebody that we suspect overgrowth or SIBO, and they can handle partially hydrolyzed guar gum. That's a really good one. It's sun fiber that can be supportive to help with bulking the stool. These different GLP-1 boosters, the pendulum, which is Akkermansia, LifeVantage, CaloCurb, and then GLP-1 RAG. That's 4 of them that I see pretty common. Muscle boosting products. So there are some other things we can do through supplementation to help patients. So I think about the vegetarian. I think of somebody that I know for sure is not eating enough. These are 3 different products that we like. Sherry uses this Myos MD quite a bit, and it is raw fertile chicken egg yolk. And there's a lot of studies out there on it. What it does is increases the muscle protein synthesis. So it comes at it from that standpoint. This Body Health Perfect Aminos, they come in tablet form, but they also come in a powder with electrolytes in there. So this one I really like it. The one that's in the tablet form, you can take and stay in fasting mode, which I really like as well for those people that are extending their fast. And then the urolithin A. So this one has been brought up quite a bit in the anti-aging and longevity world. What it does is produce or improves cellular health, and it is shown also to help with the cell health of the muscle and improve muscle strength. So, 3 different approaches. So kind of look at and assess your patient and which would be the best approach. But I find patients are really willing to take some supplements to help out, maybe with the things they're not quite doing in the diet. So these could be good options for them. All right, so this patient, we actually have a whole video on YouTube where she talks about her experience. She's a 63-year-old who lost weight and kept the weight off afterwards. We like to follow our patients afterwards. Not all of them follow up with us when they're doing well, they're on to the next thing. But this patient has stuck around, been a very regular patient for us, but she was on progesterone. And her big thing was she was binging at night, pretty typical for menopausal women, slowly gaining weight over the last 10 years. She got too relaxed with her diet. She had a lot of social events and was eating out. So she was ready to get on track. So she was somebody that went 100% compliant and gets movement daily. You can see at week 2, this is what she said. She had increased energy and improved sleep, and her hunger was suppressed. By week 4, her belly felt slimmed down, and she started reading food labels and really getting curious about the things that she was putting in her mouth. At week 13, she started to get some constipation at that higher dose. And then what we really talked about was upping her magnesium, and we discussed increasing fiber for her. Okay, so what after she got to her goal. So like let's look down here. So 185 pounds is where she started. She went down to 153.9. So I like looking at the dry lean mass, but I also look at that skeletal muscle mass. So you can see she was at 59.7 up at that high end, and she went down a little, but not much, down to that 57.8. So that was excellent. She went from 16 in visceral fat down to 10, which is exactly where we want to be. So really great example, 100% compliance, was getting movement. We did not see significant loss in muscle mass. Okay. I will talk about the supplements a little bit later. I got a question in here. Okay, so what we did for her, because as you can imagine, people are nervous once they go off of these medications and what's going to happen. So she's somebody that we ended up prescribing a vial to, and she weaned down. Her top dose was 0.75 milligrams, and she weaned down slowly over a course of 4 to 6 months. So she was able to keep that weight off after she was completely off, but then she ended up having a foot injury and a surgery and was completely inactive for several months. So you can see her history and what happened here. And what I like to see, if we just have a weight, for example, you can see she came up a little bit. But what I like to point out is, look, her skeletal muscle mass, when she, ended here, she started gaining this muscle mass. Look at the significant amount of gain here. So when we really focus and everything, like, look, the possibilities are really phenomenal. All right. I do want to talk about a little bit more how to assess, or markers that are helpful to assess metabolic health. So this is actually a finger stick kit that we have. Not all of these, I'll show you on the next slide. We have a finger stick kit. So for people that don't have access to a phlebotomist, these are things you can hand out in your office or send out to patients if you're virtual. So we like to look at insulin, fasting insulin, A1C for glycemic control, the cardiometabolic, looking at the lipid panel, but then let's look past that at some of those inflammatory markers for cardio. Looking TSH, yes, but really looking further at T3, T4, testosterone, free and total, especially for men. The sex hormone binding globulin is also really good, because if that doesn't get tested and hormone levels look normal, it could be related to that none of them are actually available. They're all binding to this, the binding protein. We do want to assess kidney and liver, and then also nutrition status. So iron and ferritin, these often can be off when we have gut issues. The omegas are really important for inflammatory conditions, CoQ10, especially if they're on a statin or have heart issues, B12, A, selenium, vitamin D, all important for metabolic health. So this is the metabolic health panel that we use, and you can see the 17 different markers that are tested here. And it comes in this nice little box, and then patients can get them over time, and you can see the trending, and it prints off a really nice report. So this could definitely be an option if you don't have a phlebotomist available. So we'll ideally do this at the end of a program to assess where they're at with their metabolic health, and can they have a more liberalized diet, more carbohydrates, expand there. So we don't get a whole lot of males in our clinic, but we do get some. And I will say that we usually have a really big difference. The females have a lot more of the emotional pieces and obstacles that way. I feel like when we tell a male, this is how to eat and these are the things to do, they're much more compliant, and it's more black and white. I'm not sure if you see that, but that's what I definitely see. Here's what we did with him. He was 90% compliant. We really focused on resistance training and cleaning up the diet and hydration. So with him, it was small steps over time. It wasn't, he didn't do everything all at once. And it was something we had to continually go back and remind him about. So that hydration piece, and this can be so easy to not think about the water and how important that is, but it can cause constipation. It can decrease your energy levels. It can cause food cravings. And then I guess this would be a good place to address Karen's patient that she had. So she was saying that after 2 weeks of being on the medication was getting a lot of the muscle cramping. So yes, hydration. Like this is one of them that I'm not even, oh, it's okay if you don't get as much. Like, let's work on it a little bit. No, we have to get that hydration piece in order to, and I try to explain it to them in a way, in order to actually flush out the fat that you're trying to burn off and eliminate, we need to increase that water intake. So that oftentimes motivates them enough to do a little bit more. I do like electrolytes. I think that is a great option for people as they're losing weight, as it gets hot and they're sweating. People that have dysbiosis, have gut issues, they often need additional electrolytes. So I think adding electrolytes, LMNT is a good one. Buoy is another good brand, and it'll give some flavor to their water and maybe make it more palatable as well. So I definitely recommend that. Epsom salt baths can be helpful. There's also magnesium, topical magnesium lotion that you can put on. Sometimes it's that lack of magnesium, lack of B12. So I would assess status of, how much that patient's actually eating. Are they getting a variety? Make sure to get them on a multivitamin. And then, yes, you can do the electrolytes, but water is like a no-brainer. We need to get more water in. This is what we saw. So this is how we use, like I said, practice better, and we create a recent activity in the notes. And this is what we put each time in that recent activity. So we have their starting weight, their current weight, their last weight, their total weight loss, when they're doing their next in body. We track their visceral fat, their symptom score, and then their muscle mass. So all of these at quick glance they paint the whole picture of what's going on with this patient. So you can see this patient, he lost 68 pounds in the last month. It was 5. We're going to do another in body in a month. You can see the trend of his visceral fat. So 16 to 9, which is amazing. Symptom score of 0. And you can see his trend of muscle mass. So went actually up in muscle mass, then came down, then went back up. So all things that we track. So when I take a step back and look at the key takeaways, catch it quick and stress it before when it comes to muscle mass, showing this to patients of what we see as trends if they follow 50%, if they follow 80%, like giving them the actual data sometimes is helpful, or walking through how they're going to get that in the first couple of weeks, or giving access to you in between sessions if they're running into a problem. Low dose often works so great. We don't have anybody at the max dose. We keep them at the lowest effective dose possible, and it alleviates those symptoms. Consider healing the gut first. It really can make a big difference, and weight loss will go faster when the gut is optimized. Maintaining and losing afterwards is possible. It's really about getting all of those habits in place as you're working with them. And it is it's a game changer when it comes to removing the food noise for patients. So if they've had the cravings, the noise, constant hunger, insulin resistance, it's a really wonderful tool. All right, so I am going to switch gears here. I know we only have like 20 more minutes. I'm going to switch over into a consult. And this is the actual training we do for our providers. I think it's really important that I'll go through this, the way we approach this. So we're going to review the intake form. we always have an intro video as an option. So we automate all of our stuff and we send out this intro video so they have some idea. We also, if they come into the clinic, have a menu of services that they can look at while they're in the waiting room. It's really about greeting the consult in a really comfortable way, answering their questions, the mission and unique qualities of what you provide so that they understand who you are. We discuss the available programs. I think it's really important that you, as the provider, give what you think is best, but also hear the patient and what they're most interested in and have that dialogue back and forth. You present the program cost and get the response and then make a recommendation. So the highlights of the intake form. The intake form is crucial. For those of you that have a really good intake form, you know what I mean. It takes out so much work of having to ask and having to chart and all of that if you ask those right questions up front. So make sure you're reviewing their health history ahead of time. Their health goals are really important. I want to know exactly what they're coming in for. Yes, if it's a weight loss clinic, weight loss, but it might be much more than that. And this would give them an opportunity to do that. Review the symptoms briefly. Sometimes I have missing pieces or I have questions. So I write those down before I go in and talk to them. And I can't stress enough, like having that plan prior to talking to the patient is crucial because then they'll know you actually took that time to get to know them prior. So developing that trust and rapport, we have a 20-minute consultation. So it's a very short amount of time that you ask them to spend all this money. They have to feel comfortable and safe and that you are going to provide value for them. So thanking them for coming in. They're often really nervous because they've probably failed before. They've had some bad experiences. They don't trust themselves. So making them feel comfortable, making them feel heard is really important. Also, you get those chatty people. So making sure you set those boundaries up front, letting them know how long the consultation is, that you went over their intake form already, and using that experience to to guide the conversation, because sometimes they'll just get off on a tangent and having to bring them back. We talk about our mission and why we are different. There are so many people out there that can provide care, but are we a right match? So we really talk about how weight loss is multifactorial and the body is complex, and that's why we individualize programs. And we also do, the specialized testing for people so they can get custom programs. So I can't stress enough, especially if you have a lot of program options, only reviewing the pertinent programs, really trying to limit it down, because a patient that's confused is not gonna, or a customer that's confused is not gonna buy. So trying to limit the number of options, but also walking them through enough so they get the idea of how you're going to take them from struggling and overweight to confident and healthy and at a weight that they feel good in their body. So taking them through the steps to get there is also really important. And I will tell you, a big piece that people are really asking is, okay, great, I'm going to lose weight with you, but what afterwards? Because they're scared because they've likely yo-yoed before, or they're going to put all this work into it, they don't want to gain it back. So providing some maintenance education and support and talking about what you'll do at the end will help ease their fears around that. So conclusions on this: discuss 1 or 2 programs only. Asking if they have questions. So finding places to pause, not just constantly talking, especially ones that are maybe nervous and not talking much, asking them to have dialogue with you. I try to get them talking at the end. If they're still thinking or they're unsure, I'll start asking more questions. Are there any programs that stand out to you that we discussed that you want? Giving them a minute to think. So maybe step out for a minute and give them room and space to look it over and think about it. So delivering it with confidence and affirming it's a good choice is also a great tactic, reiterating and finding the thing that was important to them and their goal for the program. This program is going to be transformational for you. I understand it's a commitment and cost, and starting the plan as soon as possible. So get an idea in their mind. Some people actually are like, I cannot do it for a month because I'm on a trip or whatever, but most want to start it right away. So trying to have the ability to start them as soon as possible can also be helpful. When they are uncertain, digging deeper into their motivation is going to help them. So first of all, trying to identify what's holding them back. So straight out asking them, it seems like you're a little bit hesitant. Is something hold you back? Cost, structure, commitment. And when you can figure out what it is, then try digging deeper into that, helping them visualize, yes, you want to lose weight, but why? But why? Digging deeper into that. And when you can't get them to open up or relate, asking them or trying to come to where they're at. I know this is a hard decision, but I don't want you to put your health off any longer and struggle. I don't want you to be in the same place 6 months from now. So it's not, if you can come at it in a way of caring about them, it's not really even sales. You don't feel like you're selling. A lot of people will have the budget issue, and this is really the mindset change and helping them. It could be even helping them realize, okay, so let's talk about this a little bit. Where are you spending your money? So many people are getting their coffee out every day, and you just add that up. It's pretty crazy what people are spending on eating out or fast food, shifting their grocery bill, their shopping habits. I've had patients even come in and say, okay, I'm going to spend $500-600 on this test or this program because I don't want to buy a whole new wardrobe of a size bigger. So they rationalized it and were able to say that this is a really good investment. So in the end, if they're still saying, I don't know, then you can offer, because some people just want that discount, offer a discount or something free if they commit today. Always try to start them that day if you can, or put them on the schedule so that they have that in mind already. It's like a mental thing to say, yes, I'm going to commit, I'm going to start. Require a deposit. That's a really good idea, because sometimes people will go back and hem and haw and should I do this? Should I not do this? And if they're on their way out, they haven't purchased, maybe even offering them some other value, something else free, an online program or something, you have a booklet of 3-day detox plan or, something like that, because then they will see the value. The more we can give value, the more they potentially will come back. Okay, so we covered 2 very different things today. Here is now like a synopsis or a look at the last 4 weeks. So these are questions that I would want you to be able to answer and reflect on. What are potential benefits and drawbacks of a high protein diet while on a GLP-1? How might intermittent fasting complement or conflict? What are specific tweaks that you can make to the diet? So I want you to go through these. If we have a little bit of time, I'm going to ask some of these questions. This was in my week 3, the self-sabotage, people who lack food knowledge. So definitely take some time through here. In summary, GLPs fit all shapes, sizes, lifestyle, ages, motivation, education level. There is a place for these as a tool, not as the sole solution, but you can see all different ages and different situations here. Keep focusing on those symptoms. That's why checking in on symptoms every time is really important. Their intake. So having them track what they're eating, especially their protein, and asking things in different ways to really assess, so when we say, oh, are you eating your fruits and vegetables? They're going to say, yes. What fruits and vegetables are you eating? X, Y, and Z. And then when they actually track, they're, not eating enough. Be that expert, listen, but give expert recommendations. Confidence really is everything. They don't know what they're doing. And they're looking for someone to give them direction. So be confident in what you're suggesting. Practice that consult and your language for delivery. We have our providers actually record themselves doing it and we go over it. And I know that's really uncomfortable, but the only way we get better at this stuff is practicing and getting feedback on it. And then I know this was not in here anywhere, but charge what you are worth. We often, and I can't tell you how many times I've given away free advice and counseling and all of that. Make sure you're charging what you're worth. All of you have really valuable skills and resources and things that you provide. So make sure you're doing that. Things to think about. So, what is your structure of support for your patients? If you find that they're messing up in between sessions, maybe you need to get it more frequently, or maybe you need to have touch points or ways that they can communicate with you in between. Maybe there are different tracking tools that they can use. Is there a way to partner with different providers so that you can collaborate on that medication management? How are you positioning yourself differently in the industry? Because, and it's not about, I think there's room for all of us out there, but there are right people for you specifically. So when you share who you are and who your right client is, they're going to find you and it's going to be a much better match. I have a pre-consult video and a post-consult follow-up protocol that we follow. So if they don't commit that day, how do we follow up with them afterwards? So I have that in the modules. And then we are on to questions. Okay, so Sherry mentioned that we're going to have a symptom questionnaire. Is that in the portal? I will double check, Margaret. It should be there. So we have a questionnaire that we do in the very beginning because we want to know prior to working with us, what their different symptoms were and has it changed since on the medication. And then we have one that's the biweekly or monthly symptom assessment as well. So I will double check, but each of the modules have the actual slides and the recording. And then there's a second one that includes all of the resources for that week. Okay, so the other one was, are these mentioned supplements safe for lactating moms or patients? Oh, so that's also a very specific, let me go back to this one and see. Anytime, I'm recommending supplements to a lactating mom, I will always have them go back to their provider and make sure that they feel comfortable with that. I really don't like having a whole lot of supplements during lactation. There are some that are fine. I feel very confident, like fiber supplement is fine. The Prokinetic, actually, the one that has just ginger and artichoke, that should be safe and fine. A probiotic would be fine. Some of these other things, though, I probably would not recommend.